Depression does more than what you think. It destroys your peace, hope, and dream. Today we have the concluding part of the interview, Depression Among Youths, with Dr. JINA HEIKRUJAM, Psychiatrist, District Hospital, THOUBAL, with our interviewer, KAKCHINGTABAM RITESH Sharma. You mentioned about genetically connected with depression and all, but if you have to say depression and family history, how do you intertwine them? How do you connect depression and family history?
Suppose a person who has come up to me with a problem, with the symptoms of depression for, say, let's say 2 weeks timing.
Okay.
When we go into the history of the person, because when we meet the person, individual for the first time, we sit down and we talk to them for more than 45 minutes, trying to take down the history, the family history, the personal history, all other details that has been happening with them and what are their problems. Because it takes 45 minutes because nobody is that willing to open up easily.
Right.
You need to give them ample amount of time for them to feel comfortable so that they can tell you what their problem is.
Right.
That itself is also not enough. We call for review every time. The first review, I usually give the first review after 2 weeks of giving them the medication. And you call them for review, they come back to you, and then you have that alliance with the patient.
Right.
They understand you. They know that, okay, we can trust this doctor and I can actually open up about my problem to this doctor. They start opening up. So this goes hand in hand with not just psychiatrists, a psychologist also. Because as a psychiatrist, we have a lot of patients and we very sad that we cannot give one patient a lot of time that we actually want to give, because the amount of psychiatrists that we have in our state itself is very less. The country, I would say, not just the state. Even if we want to, we can't like every time give that amount of time to each 45 minutes or 15-20 minutes. There are times when we can't even give 10 minutes to one patient because you have a lot of patients lined up.
Right.
So you have to go hand in hand with a psychologist. So once they start opening up, they do tell you about the family history. But this is mostly about the endogenous depression.
Right.
Those are the ones usually with the family history. The other one, the exogenous, is more or reactive depression as we call it. The other one, they usually do not have family history. It's because of the ongoing problem that they have been facing for quite some time.
Right.
And all of a sudden, something major happened and they face a problem which they're not able to cope. And then all the symptoms starts coming out. So these are
the spark.
It's the spark.
And very interesting question which I really want to ask is, how do you determine if an illness is causing depression or a depression is causing an illness?
So when we say that an illness causes depression, for example, cancer, AIDS, a person with cancer, the immune system, it's deteriorated, fully deteriorated. Not just physical. When you're physically so tired and so exhausted and you're going through a lot, automatically the mind also becomes very weak. So when the mind becomes very weak, then the symptoms of depression start coming up. Cancer and depression are interrelated in that way. Someone with cancer, with a compromised immune system, they will not be able to do the things that they used to do before. There will be a lot of restrictions in the food that they eat. Let's start from the simplest thing. There'll be restriction in the food they eat. There'll be restriction from where they can go and where they can't go.
Right.
So what you have been doing all this while, all of a sudden there's a break in it. At one point of time, you will feel like a burden to your family. Which nobody wants to feel like that.
Right.
Nobody wants to feel like a burden to anybody. When they start having these emotions, then they start feeling helpless because they are in that condition, not something which they want to, but unfortunately they are in that state. They start feeling helpless. They start feeling hopeless. And then at one point they'll start feeling guilty. All this emotion starts to give off feelings of sadness and then sleep disturbance. They'll even have anxiety. Okay, what will happen? If only it could have been different. The sense of anxiety also would be a part of it. So cancer and depression, it's one of the major things. Then AIDS and depression, again, the same pattern. Immune compromise, things that you used to do before. This happened to me. If I could have done things differently, it wouldn't have been this way.
Yeah, right.
That resentment they'll start having.
Right.
A disease causing depression would be diseases like cancer, AIDS, example. These will be the diseases that will cause depression. And depression causing disorder would be, there's something called somatization that we always talk about. That's when somebody with depression, they're not able to say loud that they are sad.
Right.
They're feeling left out or lonely. But the mental baggage that they have, it projects out as a physical symptoms.
Okay.
So they're going to be like body ache, headache, burning sensation over my forehead and over my scalp. My back is hurting. My knees are hurting. My body is aching and paining.
Okay.
When you do all the tests, they're going to come clear. It's going to be clear. But the mental baggage that they have, which they're not able to pour it out, which they're having difficulty venting it out, that presents itself as a physical symptoms.
What are the basic symptoms that a person get to know? In a family, if you happen to be a mother or if I happen to be a father, then if I want to identify whether my children or whether my brother or sister is having depression or not, what's the easiest way to find out?
Okay, so first they will start avoiding people. They won't want to mingle. Before, they would be the kind of kids who will always want to mingle with their parents, with their friends, always want to go out. But then all of a sudden they'll be like, no, I'm not interested. Let me just stay put at home.
Okay.
It's one of the symptoms that you can see. This grades start dropping.
Okay.
Dramatically, the grades start dropping. And then they'll be constantly sad. They'll become very irritable for no reason. You say one thing to them, they start screaming and shouting.
Okay.
They might avoid eating. They might have difficulty sleeping. These are few of the symptoms that you will see in a child. And when you start talking to them, they might come up saying that I'm not interested in doing anything. I don't think anything is going to get better.
Give up.
They'll start giving up. And one thing with depression is that when it goes unnoticed, chances of suicide increases to a great level, not just for a child, but for anyone with depression.
Okay.
So when the things that we need to take care of is when somebody says that, okay, I feel like dying, I feel like committing suicide, we tend to take it lightly. But when somebody keeps on saying it, I don't think it's wise on our part to take it lightly. We can always spare 2 minutes of our time. It could be our children, it could be a family member, it could be a friend, it could be an acquaintance. I think it's all right to spare the 2 minutes and let them vent out what they're feeling and why they're talking that ways.
Right.
Because it's all pent up emotions. When they start talking about suicide, I think we should give them time. We should spare them that 2 minutes of our time to let them vent out their emotion. If they want to cry, I think it's all right. Let them cry. We can't tell, don't cry.
Right.
It's very common that people say, don't cry, stop crying. I think, why not cry? If you're feeling sad, if you feel like crying, cry. Why not? Because it makes you lighter.
Right. True.
We just have to be a little more vigilant. If we have anyone in our family who does have suicidal tendency or who seems a little depressed, if you just have to be a little vigilant in a way that to see if they are doing anything out of the ordinary.
Right.
Like if they're keeping anything that could help them in committing suicide. If they are keeping any, for example, gun or something. If it is easily accessible to them, they might just pick it up one day and use it. So these kind of things, we have to be a little aware of it. And if they are like writing suicide notes, if we do happen to find anything, it's wrong to go through a person's diary. But if it is just lying there on a piece of paper, if they do happen to write it, then I think those are the times where we have to be a little more vigilant and talk to them. Because when a person does want to commit suicide, it's a planned thing. A lot of people come to the hospital for poisoning. It's a very impulsive thing. They do it just because they're so angry at that moment. They're so sad and they just want to avoid the situation. So they just pick up a bottle of phenol and just drink maybe a cap of it. But that is not a pre-planned suicide. When a person does actually want to commit suicide, when they actually want to die, that's when it will be fully planned. So these process will go on for like a week's time. They'll start giving off their things. They'll start meeting the family members who they have been met for quite some time.
Right.
They'll start being emotional and tell you things that you never thought you could hear them say such things.
Okay.
So these are a few of the things that we need to be aware of.
Okay, strange and uncanny things. Okay, what about diagnosis and treatment about this?
The treatment of depression is hand-in-hand work of psychiatrist and a psychologist. Psychiatrists will give the medication. Psychologists will give the cognitive behavior therapy, or also known as the talk therapy.
Okay.
So these two, when psychiatrists and psychologists goes hand in hand, the outcome is much better.
Okay.
We start off with medication. The most preferred medication would be the selective serotonin reuptake inhibitor, or SSRI, what we call. So these are the preferred medication that we give. And along with that, we tell the individual to go for counseling, where they will be given 20 to 25 minutes when we call them on a weekly basis or 2 weeks basis, and they will be talking about venting out their emotions.
So is it like a group group or something.
Yeah, so the outcome of it is better that way. But for children, I don't really prefer giving medication to kids for children.
Okay.
Because I feel once the parents are made aware of it, once you can make the parents understand that their child is lending into depression, if it is an reactive depression, if their child is lending into depression because of the family problem, I think medication, for me, I would prefer to tell the parents, have a talk with the parents and make them understand first. Because once the family situation gets better, the child will automatically get better.
You mentioned something about medications. So when you say that, is there something about drug interaction with depression medicine?
Depression medicine, SSRI is the one that I've said.
Yeah, the name which sounds scary. Okay.
Yeah. SSRIs, they have minimal interaction.
Okay.
And there are few studies that say that when SSRIs are given to a pregnant woman, there are few studies that say that it passes the placenta. But the very safe SSRI is escitalopram, and that usually does not have any as such major interaction with any other medication.
Okay.
And plus the dosage that we start off is quite low. We start off with a very low dose until and unless the person is like major depressive disorder.
Okay.
Then there's suicidal, super suicidal. Only then we start off with a higher dosage. Usually we start off with a lower dosage.
Okay.
So interaction with other medication as such is it's not much.
It's something which is very uncanny, and it's not that men are more superior than women, but why are women more likely to get depression? Why is that?
Women, I think, again, when I talk about women in our society, when I talk about women of India, women of our state as such, we're still in the state where patriarchy is still at large. Even if we say that women are doing much better now, this is a fact. Patriarchy is still at large. So a lot of women, especially women in village areas, nobody really given importance when they say that they are depressed. When a woman in a rural area says that I'm sad, they are not going to be taken to the hospital for it. When you say that my back is aching, then they might be taken to the hospital, but usually it is not the other way around. So when women are in such a state, still oppressed in so many fields, then this is bound to happen. A lot of time, I'm very privileged to be born in a family where I can speak up my mind.
Right.
Not necessarily that everyone would be. From afar, they might seem okay, but when you go in deep and when you start talking, they might come out with a lot of emotions which they usually do not say it out loud. A lot of pent-up emotions might come up. So still oppressed in that way, I think, could be because of the reason why women tend to have more of depression than men. Then the coping mechanism itself, how you cope with a certain situation, that itself also plays a major role in it. People talk a lot about feminism also nowadays.
Right, yeah.
And it's a lot of times the concept of feminism is taken in a very different way. When I say feminism, I don't mean to say that men are bad. I'm not saying men are bad, but men and women need to have equal right, and men and women are equal. And when I say equal, it's not biological equal. I'm talking about cerebral equality.
We can keep on talking, and I feel like extracting more and more information from you, but we have to end it here. What would you like to talk, being a young doctor in this field where people tend to think in some way or the other way? What you would like to tell the society or the family or those who are hiding in the closet thinking that if I happen to say I have this kind of issue, people might think I'm mad. So what do you want to say about this?
First of all, you're not the only one. There are a lot of people who have similar problem like yours. If they can come up and say it out loud, you can also do it. If I can do it, you can do it too. So it's that way. Please come up if you have any issues. Tell your parents, tell your friends, because you're not the only one. There's a lot of help out there for you. And I hope you do come out of it, because nobody wants to stay in that dark closet.
Right, yeah. True. So hope to see you soon. And
see you soon too.
And I hope like we would get to interact sooner or later.
Yes, definitely. Thank you.
Let's fight depression together for better life. Well, that's the concluding part of the interview, Depression Among Youths, with Dr. JINA HEIKRUJAM, Psychiatrist, District Hospital, THOUBAL, with our interviewer, KAKCHINGTABAM RITESH Sharma. We will be back again next week with a new topic. Until then, take care, stay away from depression.